So what is HIV disclosure? HIV disclosure is when you tell someone that you are living with HIV. HIV is an invisible disease, meaning people can't tell that you are HIV positive simply by looking at you, by the way you speak, or how you walk. Even close friends who have known you for years may not know that you are living with HIV. Many people in your life may never know about your status, but there are some people you may want to tell. The first question to ask yourself is, why disclose? Disclosing your HIV status can have a lot of positive effects. Telling your partner can improve trust and intimacy in your relationship, help you and your partner make safer sex choices, and if your partner doesn't know their status, it can encourage them to get tested as well. Telling others, like family and close friends, about your status can also make it easier to access healthcare and help you start and stay consistent with HIV treatment. There may be other health benefits to sharing your status as well, like being able to get more social support, having higher self-esteem, or lowering your anxiety levels. However, disclosure can also be a very challenging process, and disclosing your status is not always the best option. Some people experience negative reactions when they tell someone, which can include rejection, anger, violence, or discrimination. Also, once your status is shared with a particular individual, it cannot be unshared. That person could tell other people about your status. If someone reacts poorly to finding out you are positive, it can feel really bad. Anxiety about sharing your status is common. It's not an easy process. You may feel a lot of different things when you think about telling someone that you're living with HIV. Let's sort through some of the feelings and thoughts you may have about disclosure. HIV is a virus, and viruses themselves do not discriminate. However, even today, stigma and discrimination towards those that are living with HIV still exist. Stigma is when people think less of you because you are living with HIV, and discrimination is when people treat you differently. Stigma and discrimination are sometimes based on people having incorrect information or negative beliefs about HIV. Other times, it can be rooted in prejudice against the LGBTQ community. Hearing negative messages, particularly from those close to you, about HIV or people living with HIV is hard. It can impact how you feel about yourself even if the messages aren't true. It is important to remember that you cannot control how someone else feels about HIV or how they react if you disclose to them. It is not your responsibility to make them understand or accept your diagnosis. These messages do not reflect reality. However, when we internalize them, they can shape how we see and feel about ourselves. Fear of receiving negative messages from others and negative feelings inside of ourselves can lead to feelings of loneliness, isolation, and depression. Putting up walls can protect you from these negative messages, but can also serve to keep out people who may be able to provide support.
Yay!